Amid the COVID-19 pandemic, many women in the northern regions say there have been an increase in domestic violence and intimate partner violence. The women say domestic violence and sexual exploitation, which is already an epidemic across the world, spiked when households were placed under the increased strains that come from security, health and money worries and cramped and confined living conditions. It is for this reason that they are calling for a domestic violence ceasefire, especially in the northern part of the country. The ongoing COVID-19 pandemic and its countermeasures have led to varying physical, psychological and emotional experiences, shaping not just public health and the economy, but also societies. Prior to the pandemic, it was estimated that 1 in 3 women will experience violence during their lifetimes, a human rights violation that also bears an economic cost of $1.5 trillion. Many of these women are now trapped at home with their abusers and are at an increased risk of other forms of violence, as overloaded healthcare systems and disrupted justice services struggle to respond. There is growing evidence that domestic violence acts as an opportunistic infection that thrives in the pandemic situations. Women in the northern part of the country, in which the victim could not move out of the home to seek the appropriate help, and were also cut off from their normal support systems.
If you are in the house and there's no money, it's not easy. And the men too, because you were all together all the time, the man sees you, you are being attracted to the man. And though the normal thing is to sleep in the evening, but you realize that the sleeping was too abundant. Either in the morning, afternoon, evening, it was also just like the breakfast, the supper, the lunch. And because there wasn't money, these things too need peace. If there's no peace and all the time you are also on one another, you realize that it wasn't good enough.
In the case of domestic violence, it is mostly perpetuated by family members who abuse, attack, humiliate and torture women and children. There are numerous reports and unreported domestic violence cases in the north, including physical, verbal, financial, psychological and sexual abuse. The consequences of COVID-19 also limited access to life-saving resources for survivors of violence and those at risk, such as psychosocial health and safety programs. The women who faced first-time domestic violence blamed the lockdown on their situation. Speaking at a town hall meeting organised by Send Ghana to ascertain the level of harm caused by the virus on the vulnerable, gender advocate Hajia Lailatu said the women are being emotionally traumatised.
We realized that the women too, some of them were at markets doing petty trading. Because of that, all those things have to stop. And the children were in the house. Food, they used to go to school, they eat school fees, they were fed in the school in the afternoon. So the only thing was to give them breakfast. But lunch, they will be provided there. And then supper, that is the only one you also prepare in the evening for them. But the supper, the lunch, breakfast, all was a burden for parents. And all these things, you see that it's not easy. The children themselves were even abusing themselves sexually. They were abusing themselves.
For me to buy pad, I couldn't even afford to buy pad. And because of the COVID-19, I cannot go outside to get some petty job to work and earn an income. So at least I was always squeezing myself and staying and using racks, which it is in the past. So now, because of the COVID-19, I don't know what to do. Just there, no pad to use during my menstrual cycle. So I think if government can come in to support we the adolescents, especially we the vulnerable ones, to provide or to buy pads for us to use during our menstrual cycle.
The scarcity of social activities and financial pressures have increased rifts within families. Men are frustrated about losing their jobs because of the COVID-19 lockdown and express their frustration by humiliating their wives, physically and mentally tortured by husbands, families and their own family members. Domestic violence also internalized social norms and practices in both rural and urban areas of the north. Victims are also sent back to their abusive husbands from their family homes because it affects her family's reputation. The women call on the government, non-governmental organizations, community-based organizations, voluntary organizations and religious leaders to use various media and other platforms to raise awareness. They also suggested that social media should be used as a forum to raise awareness of domestic violence. Also, law enforcement agencies need to have more operational tools available to respond and take the appropriate action at all levels, such as district and sub-district levels and village areas. Research findings suggest that the effects of the pandemic go well beyond immediate health concerns, leading to important normative changes that are likely to shape how Ghanaians will emerge from the pandemic. Although government has introduced and expanded on social protection programs during the pandemic, results have been mixed on the basis of available anecdotal evidence. There has not been a systematic way to date to gather citizens, particularly vulnerable and marginalized groups' experiences and perspectives on how social protection interventions under the CAP have served the needs and met the aspirations of the average citizens.